Hello and welcome. Today we're diving deep into a significant kidney condition often linked to high blood pressure, hypertensive nephrosclerosis. Hypertensive nephrosclerosis, as the name suggests, is primarily caused by long-standing, uncontrolled high blood pressure or hypertension. Over time, this relentless pressure damages the delicate blood vessels within the kidneys. Think of it like this: consistently high pressure on any hose will eventually weaken and damage it. Similarly, the small arteries and arterioles in the kidneys, the workhorses of filtration, are particularly vulnerable. Other contributing factors can include diabetes, smoking, and high cholesterol, as they worsen the impact of hypertension on blood vessels. Now, let's delve into the pathophysiology, what actually happens in the kidneys at a cellular level. Prolonged high blood pressure causes the walls of the renal arterioles to thicken and harden, a process called arteriosclerosis. This thickening narrows the lumen, or the inner space, of the vessels, reducing blood flow to the nephrons. Nephrons are the functional units of the kidney responsible for filtering waste and regulating fluid balance. With a compromised blood supply, the nephrons become ischemic, meaning they're deprived of oxygen and nutrients. Over time, this leads to nephron scarring, also known as glomerulosclerosis and interstitial fibrosis. As more nephrons are damaged and die off, the kidneys lose their ability to filter blood effectively, leading to a gradual decline in kidney function. The glomeruli, the filtering units within each nephron, also become damaged and sclerosed, further reducing the kidney's filtering capacity. Hypertensive nephrosclerosis is a common cause of chronic kidney disease, particularly in older adults and individuals with poorly controlled hypertension. Its prevalence varies depending on factors like age, race, and the prevalence of hypertension in a given population. It is more commonly seen in individuals of African descent and those with a family history of hypertension or kidney disease. The exact numbers are difficult to pinpoint, as many cases may go undiagnosed until significant kidney damage has occurred, but it represents a substantial portion of end-stage renal disease cases worldwide. In its early stages, hypertensive nephrosclerosis often presents with no noticeable symptoms. This is because the kidneys have a significant reserve capacity and can compensate for some degree of damage. However, as the condition progresses and kidney function declines, symptoms may begin to appear. These can include fatigue, swelling in the ankles and feet, edema, changes in urine output, particularly increased urination at night, nocturia, proteinuria, protein in the urine, and elevated blood pressure. In later stages, symptoms of advanced kidney disease such as nausea, loss of appetite, itching, muscle cramps, and difficulty breathing may occur. Diagnosing hypertensive nephrosclerosis typically involves a combination of physical examination, medical history review, and laboratory tests. Blood pressure measurements are crucial, along with blood tests to assess kidney function. These blood tests will measure creatinine and blood urea nitrogen, or BUN, which are waste products that build up in the blood when the kidneys aren't filtering properly. Urinalysis is performed to check for protein and other abnormalities in the urine. Imaging studies such as ultrasound or CT scans may be used to evaluate the size and structure of the kidneys and rule out other potential causes of kidney disease. In some cases, a kidney biopsy may be performed to confirm the diagnosis and assess the severity of kidney damage. While hypertensive nephrosclerosis itself isn't typically classified into distinct subtypes, the severity of the condition is often staged based on the degree of kidney function impairment. This staging is determined by the estimated glomerular filtration rate, or FR, which is a measure of how well the kidneys are filtering waste. The eGFR ranges from stage 1 with normal or high kidney function to stage 5, which represents kidney failure. The primary goal of treatment for hypertensive nephrosclerosis is to control blood pressure and slow the progression of kidney disease. This typically involves lifestyle modifications such as following a low-sodium diet, maintaining a healthy weight, exercising regularly, and quitting smoking. Medications to lower blood pressure, particularly ACE inhibitors and ARBs, are often prescribed. These medications not only lower blood pressure, but also have a protective effect on the kidneys. Other medications may be used to manage complications of kidney disease, such as edema, anemia, and electrolyte imbalances. In advanced stages of kidney disease, dialysis or kidney transplantation may be necessary. Preventing hypertensive nephrosclerosis centers around controlling blood pressure and managing other risk factors. Regular blood pressure monitoring is essential, especially for individuals with a family history of hypertension or kidney disease. Lifestyle modifications, as mentioned earlier, are crucial. Eating a healthy diet that is low in sodium and saturated fat, maintaining a healthy weight, exercising regularly, and avoiding smoking can all help to prevent or delay the onset of hypertensive nephrosclerosis. Managing diabetes and high cholesterol are also important preventive measures. The prognosis for hypertensive nephrosclerosis varies depending on several factors, including the severity of kidney damage at diagnosis, the effectiveness of blood pressure control, and the presence of other medical conditions. With early diagnosis and aggressive blood pressure management, it may be possible to slow the progression of kidney disease and prevent or delay the need for dialysis or kidney transplantation. However, if left untreated or poorly managed, hypertensive nephrosclerosis can progress to end-stage renal disease, requiring lifelong dialysis or kidney transplantation. Recent research focuses on developing new medications and therapies to protect the kidneys from damage caused by high blood pressure and other risk factors. Studies are also exploring the potential role of novel biomarkers in early detection and risk stratification. Ongoing clinical trials are investigating the effectiveness of various interventions in slowing the progression of kidney disease in individuals with hypertensive nephrosclerosis.